Hey, Dr. Lindsey here with Wendy. We're going to do a series of little videos on what kind of questions you should ask when you go in for a hair transplant. We'll add to this list with subsequent videos, and it'll just be kind of an informal collection of questions that we've been asked over the years. Wendy's going to ask them and I'm going to answer them. What's the first question?
So the first question that I would ask a doctor before going into a procedure is his credentials. And how long have you been doing, say, well, it's for a hair transplant, so how long have you been doing hair transplants?
Okay, so my background is I'm an ear, nose, and throat doctor. I finished my residency in '95, did a one-year facial plastic surgery fellowship in which we did hair and facelifts and skin cancers. And I came back and taught at UVA, University of Virginia, for 4 years while my wife did her cardiology fellowship. And then we moved up to Northern Virginia. I worked for George Washington University for a couple of years while I set up my own practice. And I dabbled in hair for the first 6 or so years. It's very difficult working for a university to try to do any hair. And then as I got more established, we started doing the smaller mini graft cases that were common in the late 90s, early 2000s. And then I met Dr. Feller at a hair meeting in maybe 2000, 2001. And he and I became friends, and the difficult hurdle that it is for doctors to get into hair, and all of you potential patients should recognize this, is that you can't train your techs until you are doing sufficient hair, and you can't do sufficient hair until you have trained techs. And so this leads to the rent-a-tech problem, that where doctors try to get into hair and they hire techs that are constantly soliciting us and everybody else with we'll come work at your office for a day and do the whole case for you, and you pay those guys and you get really inconsistent work. They don't really have any loyalty to the doctor or the patient. They're going to be someplace else tomorrow, and so it's a real tough industry to crack into. And so part of the early association that I had with my current associate, Dr. Feller, is that my techs would all go up and work with him. And so our techs, we get very good because Alan had a very busy practice, and then I could bring my own techs back, and as my practice built, I had my own techs that were trained at Dr. Feller's office, and that's now 14 years ago. So now we have the ability to share techs if we need to. If somebody gets pregnant, there's always human resource issues. And just an aside, if I could buy a robot that would replace people who would get pregnant or show up with a bad attitude or have a car that breaks down, that would do the same quality, I would do it today. But such a robot does not currently exist, and so for the near term being the rest of my working age, I suspect that human hands will be better than robots. So that's how I got into hair. My practice has been roughly half facial plastic surgery and half hair, and I keep the two practices pretty separate. We don't do 2 or 3 cases a day. We do 1 hair case a day. We start exactly at 7:30, and we put all our attention into that. I'm there for the entire case. We see patients during surgical hours. I think it's really critical for potential patients to have the opportunity to see a case going on, and not just take my word for it that we do cases and that it doesn't really hurt much, but rather that I get to meet with the potential patient. And then usually we can get the patient to come back and see, usually we can get the potential patient to come back and see a case going on. They can see that everything's clean, we're only working on 1 person a day, we're not rushing to get things done, and we put our full attention into the case, rather than me having some consultant that is trying to coax you into a surgery and you've never met me and you've never seen a case. So that's the background of my medical practice, and that's the way I see it going for the next 10 or 12 years. Next question.
You answer like 4 or 5 questions that are there.
Well, that's okay.
You said how many cases do you do a day? We do one a day.
We do one a day because I can tell you that even a small case takes a lot of concentration on my part and on the cutter's parts and on the placer's parts. And whoever would be foolish enough to get in that chair at 2 or 3 o'clock in the afternoon will not get as good a job as the guy who climbs in the chair at 7:30 in the morning.
Why do you think it's important for for somebody that is for a patient that comes for a consultation to see a hair transplant going on?
I don't know. I think there's a bunch of reasons. Well, first is, does it hurt? You know.
That's like the big myth. It doesn't
Yeah,
hurt.
all these, you know, if I were going into somebody's office and they were telling me they're going to make a big cut on the back of my head or even make 2,000 holes in the back of my head, I would think that stuff's going to hurt. And so I'm pretty good at numbing people up. I've done 3,900 facelifts and 2,100 hair transplants and a bunch of other stuff. I'm pretty good at numbing things up, but there's going to be 7 shots in the back of your head at the first thing in the morning, and that they're going to hurt 3 seconds apiece. So you have about 20 seconds of discomfort, kind of like getting numbed up at the dentist's office. And then we let you sit for about 5 minutes, during which time the Valium that we give you kicks in. And there's a bunch more shots after that, but they don't hurt, or at least I haven't had it done, but we ask plenty of patients, and if you look at a bunch of my videos, I try to ask most guys that, and most guys say it really doesn't hurt after the first 7 shots. Taking out the strip or doing the FUEs typically shouldn't hurt. Then there's 7 more numbing shots to numb up the forehead, and they hurt also. And I would guess that, I don't know, 1 person in 4 requires me to do an extra little nerve block right around the eyebrows. And I'm pretty comfortable at doing that. You know, facial plastic surgeon, and lots of brow lifts, lots of eyelid surgery. I can pretty much get everybody numb without much discomfort. And so I like the potential customer to see that indeed I can get you numb. And then I also like the potential customer to see that we're only working on 1 person and that our office is clean and we're not doing a bunch of hijinks back there that I think, or at least I hear goes on at other places. So we do 1 case a day, and I think it's really important for potential patients to see that. And you know, usually if a potential patient can talk to somebody laying in the chair, that makes them feel better. And I don't know, part of the, you know, frequently there are people that are coming in for their 1-week suture removal visit, and they can tell the potential patient, you know, oh yeah, that Dr. Lindsey was crazy, or no, it didn't really hurt much. They'll also explain to them how you do have a lot of swelling when we do the front, and I try to beat it into potential patients, but only when you hear it from the patient who's just gotten these stitches out do you really believe me that you're going to look bad on day 3 or 4. It is not a back to work tomorrow procedure like some of the commercials in our area say that it will be. And then finally, it's nice for a 1-year visit or a guy that's 6 months out that's starting to grow to come in and, you know, stick his head in and tell the potential patient it really does work. It takes a little while for it to happen, but we're not pulling the wool over your eyes.
A lot of it is like, what is your involvement in the whole procedure? There's many.
Okay, so I got the question.
You got the question.
So what do I do? So I do all the consultation. I tell you all the things that can go wrong, that are likely going to happen, and I stand behind my work. Next is I do all the drawing. When we design a hairline, I draw what I want to draw, and then usually the patient agrees with me, but then there's a back and forth. If it's too high, too low, just about right. So we try to get the Goldilocks area of where the hairline's going to be. And then most importantly, we make the hairline irregular. It's not a straight line like some of the people that you might see on TV who have bad hair transplants. We put a few irregularities out in the front so that it looks more natural. So I do all the drawing. I do everything that involves something sharp. I do the numbing up. I make the FUE punches. I do the strip removal, sew you up, and then I make all the slits. And as some of my videos about planting trees goes into, you know, it doesn't matter who places your hair as long as they do it gently.
As long as who's.
Yeah, because the hole dictates the direction the hair is going to go in. So, for example, if I were to dig a hole where my chair is and I would aim it towards the door, no matter who came in and planted a tree, they could not aim it towards Wendy. It'll aim towards the door. So I make the holes how I think they should be made, and then we have a couple of placers. Wendy's been with me the longest, and they place the hair very gently. And I used to place all the hair when we did smaller cases, and then I placed half the hair. And now, just matter-of-factly, Wendy and the other girls are faster and gentler than me. And so I hear occasionally that there's a doctor my age, and I'm 52 as of this week. You know, I can't imagine a doctor that's 52 placing as gently as her little hand skin. And you really want to be gentle with those follicular units. So all day long, I'm in and out of the procedure room. If we don't have a potential patient in, I'm back in the room doing quality control, talking with the patient, going over instructions. And so I'm there the whole day, or I'm here the whole day. And I'm available for post-op day 1 visits. And I'm available for emergencies. Fortunately, we haven't had any significant emergencies in all 21 years. Next question.
Would you recommend lasers and supplements
Okay,
for my hair growth?
Great. So I'm pretty blunt. We don't sell anything here other than surgery. I think the average guy or girl that's losing hair has 4 choices. Choice 1 is do nothing. Nobody's ever died of going bald. It can be devastating, particularly for females, but nobody has died of hair loss that I know of. And so you don't have to do any of this stuff. Choice 2 is to wear a hairpiece. Now, we don't sell hairpieces, and I've only seen bad hairpieces come in here. And my guess is that there are good hairpieces out there available. I just haven't seen them. So in general, I think that's a poor choice for almost every man. And the patients we've done that have had poor appearing hairpieces, including one celebrity, we have had no luck with hair growth in guys that have worn a hairpiece afterwards. And even though they promised me they're not going to wear their hairpiece and not put glue on, I would guess of the 5 guys that we've done that have worn hairpieces, we've had poor growth in all 5, and photo documented scalp irritation in all 5. So if you're coming to my office, if you're going to wear a hairpiece afterwards, I don't want your money. Go someplace else. Choice 3 is medicines, and there's only 2 medicines that do anything. One is Rogaine, which you buy over the counter and you apply it like it says on the box, and Propecia, which is finasteride. There's Avodart, which is a cousin of Propecia. And unlike a lot of hair doctors, I don't sell any of that stuff. I think that's a personal decision for you. We'll go through the pros and cons of Propecia and whether it's worth doing for you, and it'll be the patient's decision, not mine. I may recommend it, particularly for younger guys, but I don't push it at all. And surgery, there are no other choices. And I'm 52, it's the year 2016. I don't believe there's going to be any other choices in my practice lifetime, which is probably has 11 years left in it. You know, I think kids that are born now, there probably is going to be genetic therapy and cloning by the time they're my age, but it won't happen in the next 10 years. So you guys that are holding out cloning because you read all this stuff about growth factors and stem cells, it isn't going to happen. I'm not wrong about many things, and I'm pretty sure I'm not wrong about this. So those are your 4 choices. We don't offer laser caps. We don't offer vitamins. We do work on probably 30 Indian patients per year. A thin Indian guy who doesn't eat meat. Yeah, I think that conceivably adding protein in some sort to his diet may help things, may help him whether he has or doesn't have surgery. But by and large, if you're a typical American that's maybe a little heavier than you ought to be and you look like you're well fed, I don't think nutrition and vitamins is going to be the key to your success. If you choose to take it on your own behalf, proceed onwards, but I'm not going to sell you anything to try to increase my bottom line.
Do you do computer imaging?
Absolutely, for rhinoplasties. but not for hair.
Why?
Well, I think that you can make anything look good on a computer, and it's not very realistic. I think, I've done about 700 noses. I still do 1 or 2 noses per month, and I think that in order to show somebody what they might look like, to show them on a profile what they would look like with a certain tip or certain hump, it's invaluable. People need to know what they might look like. For facelifts, eyelids, and hair, the computer programs I've seen aren't realistic at all. It's just some type of Photoshop product where you can color on what might look like hair. That's not realistic, and so I think a much more informative approach is to have you, the potential patient, look at somebody that we've done that has hair characteristics and scalp characteristics similar to you. So at your consultation, I talk to you and I try to find somebody in my demonstration files that has a head that looks like yours, meaning that if you're a thick curly-haired Indian, we don't show you a Northern Irish guy. On the opposite, if you're a fair-skinned, dark-haired guy with fine hair, we don't show you a bushy-haired Indian that who has the best hair to cover with. So I do my best to show you kind of some 1 or 2 guys that are similar to you, and I post a lot of cases. I posted at this point maybe 160 videos and 1 or 2 hair result cases per week since 2007. There's no shortage of potential or previous patients that a potential patient can't look at and see what we do. Next question.
Do you guarantee your work?
I don't guarantee anything except that I'm going to be sober the day we work on you, and we're only working on you. That said, I want it to work almost as much as you do. And in some cases more. Some of these characters that don't clean or don't follow instructions. Clearly I want it to work more than they do, because we make it almost foolproof. But of the 130 cases we do a year, we have 1 or so every year that doesn't grow very well. And I don't know why. We do them all exactly the same way. Healthcare is not math where 2 and 2 always equals 4. It is more like cooking. You put together a bunch of ingredients in your own pots at your house, and then you go someplace else where they have different grocery stores. Things aren't going to taste quite the same. It might taste better, it might taste worse, but that's what surgery is. It's I've got an educated guess and a probability that this is going to work, but I can't guarantee you that. And I would say of the 130 cases we do a year, we have a couple of guys a year who, through probably no fault of their own, meaning that they cleaned okay, have a couple areas that are maybe a little thin, and if that bothers them and I can see it, we'll work out something. I'm not stressed about nickel and diming everybody for the last penny out of them. If, however, you don't clean and you don't follow instructions, or you pull out your hair like a guy that we recently put up a video of, I can't guarantee that I'm not going to go home and babysit you to do that. I would like to get to work as much as you do, if not more. But anybody that tells you they can guarantee something in medicine is full of it.
Would one hair transplant be enough for
a person?
For a person.
I don't know. It just depends. So, for example, you got a 52-year-old guy like me who has no history of hair loss in his family, and all he's worried about is just these 2 frontal triangles, maybe a little across the front. Yeah, one's going to do it, probably. You got a 23-year-old kid who's got this and bald family on both sides. Well, should he even be doing it or not? Or should he be waiting? And so there's no real right answer to that. I got to make an educated guess based on whatever family history you, the potential patient, have, how much luck you think you have, and whether you're willing to try anything medicine-wise, which may or may not do anything. So for a middle-aged guy, and that number keeps changing as I age, as a middle-aged guy that needs, it's thinning in his frontal third. Yeah, one case, 2,500 to 3,500 grafts, ought to take care of the frontal third. Now, if he's got good luck and good genes and doesn't lose any more, he's gone. We'll never see him again. If he has average luck and he loses some hair behind that, yeah, we might see him again. Although if he fixed the front on a guy of my age and they get a little spot in the crown, I don't know, 3/4 of the guys don't really, that doesn't bother them enough to hand out more money or go through surgery again. But you have a guy that you fix the front and you know he's going to lose more hair in behind, or he's already lost one. I mean, we can really only work with the amount of hair we can get out of your head and its characteristics on any given day. So you have a dense-haired, thick, bushy hair with good color skin match. Those 3,500 grafts will do a lot more in one case than a thin-haired Asian guy with really white skin and black stringy hair. So that's a long answer, but I can't tell you whether one case is going to do it. We'll look at your family history and your hair characteristics, and I'll give you my best guess.